Welcome back. Seton Healthcare says there are around 100,000 people in Travis County living without insurance right now.
And tomorrow is the start of their chance to sign up for Obamacare, and many still find affordable coverage confusing. KXAN's Josh Hinkle found out hospitals and clinics are preparing to point people to the right places to sign up.
Every year, 3,000 families walk into Dell Children's Medical Center in Austin for help.
The most heartbreaking example is when cancer is found in a child. And so to get the chemotherapy, to get that follow-up care.
A family will have a big doctor's bill. Kid Abney Spels runs the Insure a Kid program here, dealing mostly with low-income coverage like Medicaid and CHIP to make sure those families have a way to pay.
Today, a family may make $1 more than the income eligibility requirements for CHIP, and we don't have a good option to tell them how they can get health care and health insurance.
Now the Affordable Care Act means that group won't go without coverage, but the challenge is directing them to call 211 for a list of places for guidance and to healthcare.gov to sign up online.
It should be an interesting ride for all of us.
And until it knows more, the hospital has not made some changes, still expecting people without insurance to use the ER for primary care for a while.
Lots of us are setting our clocks to get online at 12:02 a.m. to see the launch and kind of figure out those plans.
We talked to the people here, and one of their biggest concerns is that many Texans don't realize that they can take part in this state because we don't have a state-led exchange. There is a federal exchange that people can take part in still, and you can sign up for that anywhere between tomorrow and March 31st to get that affordable health care. At Dell Children's Medical Center, Josh Hinkle, KXAN News.
As you just heard, there are still a lot of unknowns when it comes to this Affordable Care Act. We don't know how much specific plans will cost right now. We reached out to the Department of Health and Human Services for some estimates. Here's how much you could be paying. In Austin, a 27-year-old making $25,000 a year will have to pay about $85 a month for the cheapest bronze plan and $145 per month for the cheapest silver plan. Those are including tax credits. And after tax credits, a family of 4 with an income of $50,000 would pay $64 a month for the cheapest bronze plan.
So what happens if you do not buy coverage? Well, starting in January, you'll be fined. In 2014, you'll have to pay either $95 or 1% of your household income, whichever is greater. And the cost goes up dramatically in the years after. And that doesn't even begin to crack open all the information you need to know before buying. Some questions you may have: will I qualify for subsidies if I decide to buy? How many options do I have? Or even, where do I enroll? And there's a special plan for people under 30. We've put the answers to these questions and more with this story on KXAN.com.